Dear colleagues at Aerde, today I would like to present to you my Aerde Fellowship Award project, Innovative Airway Diagnostics in Respiratory Infections. I am Koen van Aerde. I'm a specialist in pediatric immunology and infectious diseases in Nijmegen, the Netherlands. I have nothing to disclose. My project proposal for Aerde was to analyze volatile organic components in axial breath of children presenting with lower respiratory tract infections in order to distinguish viral from bacterial infections. And we had quite some challenges in the setup of this study with also defective spectrometers. And in the meantime, there were projects in cystic fibrosis patients in which I participated. And then finally, when we got our study started, the COVID crisis came and the project came to a standstill. But I will present to you today the project on which I have been working. The first project was a project looking at antibiotics for respiratory tract infections in 3 levels of healthcare in Nijmegen area. And this project was performed under the flag of the European Perform Consortium. And we looked at primary, secondary and tertiary care in children without complex comorbidities presenting with respiratory tract infections. And what we found that irrespective of the level of care, antibiotic prescriptions were around 30%. And obviously in primary care, this leads to high absolute numbers of antibiotic prescriptions, namely more than 5,000 per 100,000 per year, going down in the hospital settings. And if we then zoom into the different antibiotics prescribed, the red bars here depict antibiotics prescribed not according to the guideline. And here you can see that mainly in secondary and tertiary care, there's room for improvement. If you want to read the full details of this study, you can read the manuscript in the Pediatric Infectious Disease Journal this year. The second project was a review of data on breath analysis in lower respiratory tract infection. Actually, my initial project. With pathophysiological processes in the lungs, they produce volatile organic components. And these components can be analyzed using GCMS or ENOS. And with the analysis of breath, we can see, for example, if there is a viral or a bacterial infection, or studies are done looking at pulmonary tuberculosis or ventilator-associated pneumonia. And in this review, we have tried to summarize all the current evidence, and we have made recommendations for further studies. The third project was a very unique study looking in a pediatric cystic fibrosis cohort of patients 2 to 6 years, starting with CFTR modulation therapy, ivacaftor, lumacaftor. And we know that the CFTR mutation causes viscous mucus in the lungs, but also affects immunological cells. So we were wondering, after initiation of CFTR modulation, if there will be a change in immunological parameters using whole blood stimulation assays and axial breath. And these are the findings. Looking at different stimulations and different cytokines as a readout, we saw the same pattern, namely that there was an initial rise in cytokines after 6 weeks after initiation of therapy, which returned to normal after 18 weeks. And this was irrespective of stimulus or cytokine readouts, which led us to the hypothesis that there might be some form of immune reconstitution starting CFTR modulation with an initial inflammation returning back to baseline after 18 weeks. Axial breath analysis are still pending, and we are looking forward to combining the data in one manuscript to see what is actually going on in the lungs and the immune system of the patients starting with this therapy. In the fourth project, we looked at an innovative breath sampler, the modular breath sampler, to monitor Pseudomonas in cystic fibrosis. And this is the modular breath sampler developed by a postdoc from our lab. It has a mouthpiece where you can breathe through tidally, and your axial breath will be caught in a buffer. And in this buffer, we can perform targeted PCR analysis for different bacterial pathogens. And we can compare these PCRs with the sputum cultures taken simultaneously. And the first results show a very interesting findings, namely that for Pseudomonas aeruginosa, we found PCR positivity using the modular breath sampler, which we didn't find back in the culture, leading to the suggestion that this way of sampling axial breath might be a very sensitive way to monitor Pseudomonas colonization. We are expanding our cohorts at this moment to 100 CF patients, and we are also adding 30 asthma patients to confirm these findings. And then back to my original study plan, this is going to be resumed in autumn 2021, where the results will follow and will be presented definitely at the next ESPID conference. And I hope next year spring I will defend my PhD thesis on these different projects. With this, I would like to thank my supervising team, Professor Ronald de Groot, Marien de Jonge, Michiel van der Vlier, and Peter Merkers, and all the other people from the lab, the clinical side, and Maastricht University who helped me with different projects. And definitely I would like to thank ESPID for giving me the opportunity to carry out all these interesting projects. Thank you.